their jobs well. I'll start with our vision, mission, and our outcomes. At the Department of Early Childhood, we're committed to making sure every child in San Francisco gets the best possible start. Our mission is to bring together family, community, and system supports so children have a strong foundation for health, learning, and growth. We don't fund programs in isolation. We're working to build a connected early childhood system that reaches families early before gaps get wider. And here's how we're putting that into practice. We're starting to see results in every area that we fund, especially in children's school readiness, or it's also called kindergarten readiness. It's the highest it's been ever in this city. 69% of kindergartners are meeting standards, and this is our fourth straight year of growth. More than 9,000 children have enrolled in our early Learning for All program, which is our major tuition support. And almost 7,500 children have received developmental screenings, and children with disabilities are also showing record school readiness results. Over 3,000 educators have seen their pay go up, with wages for teachers nearly 50% increases in really high vulnerable settings. These are big steps forward, and there's still so much more that we can do to begin closing our equity gaps. Next slide. As you can see, and this is something that we show every year, that all of our funding supports are correlates to school readiness. And this is a way of how we can measure whether our investments are actually making a significant change. This is our only population level data that we get for children at the age of 5, and this is why we track it. And even with these improvements, even as we're doing much more and investing more, we can also do better. Equity remains our biggest challenge. The kindergarten readiness inventory, which is done every beginning of every school year, screens every incoming kindergartner at the start of the school year on early literacy, math, social, emotional, and motor skills. Although we've started to close the gap, there's still a gap that remains, especially with children who are Latino or African American. But we're very proud to say that those two populations and children with special needs, that gap is beginning to close. But we need to be able to continue to focus on the basics where research shows what makes real difference in children's lives. Next. So these are our building blocks, and as I mentioned before, these are all highly correlate with children's school readiness. Getting children ready for kindergarten doesn't just happen. It is not by accident. It takes a coordinated effort and support very early on. The programs and the grant making we do are built around what research says matters most: quality early learning, family support and engagement, help for children with special needs, and financial stability. Programs like Early Learning for All, Early Connections, our family resource centers, Sparkler, which is a mobile app that makes developmental screening accessible not only to parents and providers, our partnership with the public library and Imagination Library, where every child under 5 gets a free book mailed to them on a monthly basis, and our newest one, Little Lift, are all working in sync as part of one coherent system. This budget is about making those connections even stronger and more intentional. This budget marks a shift for DEC from laying the groundwork to really strengthening the whole early childhood support system. Since we started just a few years ago, we've built programs and the infrastructure necessary that brings us closer to our city's vision, where every child in San Francisco has the best start in life, and our city is a great place to raise a family. Our proposed budget takes each core piece that drives our mission, which is educator pay, family affordable tuition help, quality spaces, child and family well-being, and systems that help families access resources and strengthens and connects them. For teacher wages, we rose teacher compensation back in 2022, creating a baseline, which is living aligned to the living wage. This year, we're raising that base wage again as a requirement by 16% to ensure educators earn the current living wage, and all educators earning above the base wage will receive a 10% increase. This ensures that the infrastructure that we're building across the city not only retains these high-quality teachers, but also attracts them to the field. And with family affordability, this budget expands access to tuition assistance, making care much more affordable. Any family in San Francisco with a child under 5 earning under 200% of area median income now qualifies, and that's approximately $312,000 for a family of 4. And as they enroll in our programs and in our network, families will get at least 50% tuition credit. Families under 150% of area median income qualify for the full tuition credit. And so as we're making these investments, we also know that in order to expand not only these programmatic elements of early care and education, we also must expand the support for families right from the start. Through our Little Lift program, pregnant people will receive financial help and support connecting to key city resources during pregnancy and a child's earliest months. This is part of the Mayor's Strong Starts initiative, which brings several city departments together to reduce preterm birth and connect families early to resources that improve child and caregiver relationships and outcomes. And as you can see, San Francisco is leading the nation in not only in our commitment that begins before birth, but also supporting pregnant individuals through our Little Lift program, and most recently ensuring that childcare affordability is centered to the work that we're doing by making sure that families all across our city are accessing programs and that qualify for free and significantly reduced tuition. Our model invests in educators, program quality, inclusive and infant toddler spaces, and our Little Lift program will be made available for families expecting a new baby. To keep this going, we need a stable and disciplined budget. And for that, I am going to ask Brenda Taylor to provide you with the details of our budget. Thank you.
Good morning, committee, Chair Chan. So overall, our budget outlook is still stable, even though revenues are a bit softer. Most of DEC's budget comes from special revenue funds plus state and federal sources. Those state and federal sources mostly support enrollment programs. The proposed AAO budget is for $343.6 million for FY 26-27 and $337.5 million for FY 27-28. The drop in the second year is mostly because we expect less from Prop C and slightly less from PEEF due to the adjustment that's related to the city's change in funding. We don't expect these changes to cut programming. As we spoke with the committee earlier this year, we are implementing strategic use of our fund balance in order to support the mayor's priorities and to augment our programs. Here's how we're planning to use these resources. So, as always, our budget puts community investment first, not administrative costs. So about 85% of our budget goes out to nonprofit grants. The second largest chunk you'll see in blue here, that 8%, is the 15% of Prop C that goes to the general fund. So we are essentially a pass-through agency for those funds. We don't control them. Only about 6% of our budget is for administration. And about half of that services of other departments are funding programs through other departments, like DPH. Here's how our spending breaks down by major program area. As Director Mosqueda discussed, our spending shows that early learning is still at the heart of what we do. The biggest share of the budget goes to early learning, which includes access and enrollment, workforce initiatives, program quality, and our quality spaces. Child and family well-being is our next big area, which covers our family resource centers, child health, and our cross-sector work, which is where we're really trying to support the systemization of both our CBOs or our grantees, as well as connecting the dots between the services that we provide. The budget also funds data evaluation and policy, communications, finance, operations, and compliance to keep the system accountable. This is how we're able to deliver the impact data that you see today, and also how we're able to administer the almost 100 contracts that our department puts out every year. Next, I'll break down these allocations by program. So this slide has a lot of small numbers on it. I just want to orient you to it first. So on the right, you'll see the AAO budget, which is what we've discussed thus far. On the left, you'll see the total budget, which includes the fund balance that we are anticipating using for each program. As you'll see, access and enrollment is the largest area at roughly $179 million in 26-27 and $180 million in 27-28. Workforce investments, including our compensation initiatives, our workforce pathways, which augment education and provide support for attaining higher education to our teachers, and working conditions support is our next largest investment at $86 and $87 million. Finally, quality spaces, the program and network quality, our family resource centers, and child health continue as core investments. The slide also shows the difference between, delivering the scale of work requires the right staff capacity. So this slide shows our spending over time, as well as the FTEs that we've relied on, or the staff we've relied on in order to deliver those funds. As you look down, we went from being a new department, two departments rather, to a new department, and now to a department that really is enhancing rather than building. As we deploy our AAO budget, as well as our balance that we're anticipating using this year, we are looking to ensure that we have the staff to continue our high quality programming. Now, we're set up to do this work consistent with our primary programming. So our early learning division houses all of our access and enrollment, our workforce development, our program quality, and our quality spaces. Our child and family well-being department over on the right includes all of our family resource centers, our child health, and then our cross-sector work. And then in the middle, we have our two divisions that are related, our backbone divisions, who are support. You'll see in yellow where we've asked for new positions, and those are really, 5 of them are around program quality. This is due to the expansion of our network and looking to ensure that we can maintain high quality services, but also enhance our network through our standard assessment processes. The next slide puts the staffing request in context. We're asking for these changes to make sure our oversight matches the size of our public investment. DEC manages a big grant-making and systems portfolio with a pretty lean team. Budget per staff is remaining relatively consistent across the years in this budget cycle. Our team includes leadership, managers, analysts, program staff, admin, and support roles, all needed to manage the hundreds of millions of dollars responsibly. Next, I'll talk about the reserve requesting for board-specific commitments. So as we go into the process of spending our fund balance, of course, a big share of the fund balance is on reserve, both with this committee and also with the mayor's office. And this reserve request is targeted. It protects the commitments already identified by the board. DEC is requesting $31.25 million reserve tied to 4 items. $1.25 million is for the final year of the 3-year Family Resource Center commitment. $10 million is for the child care site at Zuckerberg San Francisco General Hospital, and they have already secured a site, so that is well underway. $10 million is for a child care site at Laguna Honda Hospital. And finally, $10 million is in FY 27-28 for a child care site at the OMI Public Library. Taken together, this budget maintains our core services, expands affordability, invests in educators, and strengthens the system of San Francisco's youngest children and the families and caregivers they rely on. And with that, I will hand it back to Director Mosqueda for any questions.
Thank you. Is the Zuckerberg site the Walgreens, the former Walgreens site?
Yes, on 24th and Potrero.
And then help me understand a little bit about the process. Like, where is it at right now? Is it that we have made an offer, or is this?
Yes, so it's in the process of site control. The lease is being negotiated with through the real estate department, but we've already have the drawn up plans
Congratulations,
for the
that's
site.
huge.
It is going to be able to serve up to 60 children,
Yeah.
mostly infant and toddler classrooms with one smaller preschool, since there's a preschool program directly across the street. But the emphasis is infant and toddler, since that's where the greatest need is.
Mm-hmm. And help me understand if I understand this correctly. So this $10 million is coming from Baby C funding for the capital and acquisition. And I believe that, though, there's about $14 million also coming directly from the settlement, or from actually the contract agreements from San Francisco General Hospital, or is it not, or from DPH, or is it not?
Yeah, that's separate. That's for
Right.
operational. So this is strictly for capital.
Great. Congratulations. That's huge. And you have helped settle decades long of dispute. How about that? I was like, what is the best word to put it? So, and thank you so much for your commitment. That was a commitment that you supported along with Supervisor Malgar and Mayor Bree, and just really making sure that we can help workers at that site, at the hospital, to be able to have a child care facility. Nurses, medical staff that live and work nearby can actually have a child care site nearby of their work. So we're very grateful. I am going to, not at this moment, but down the road, and would love to have a further conversation and want to understand more sort of this, how do we help first responder to have maybe the audacity of having a 24-hour drop-off site, an operation, maybe not a 24, but allowing, again, first responder that have really odd schedules to be able to have this site as an option for them to be able to have childcare.
Yes, we welcome that conversation.
Thank you. Thank you so much for your work. And I wanted to ask too, because we have now really separate the conversation, I believe you will, or someone from your team will be back next week, Wednesday, for item that I think tentatively right now on the agenda for the early care and education. We're taking the interest, or I shouldn't say we. I think the mayor is once again taking the interest. Could you just quickly tell me how much that is?
The subvention?
$16.9 million.
$16.9 million. Understood. Thank you so much. I really appreciate it. We'll have continuing discussion.
Thank you.
Thank you. And next we will have, colleagues, we will have the Department of Homelessness and Support for Housing Now.